Hi, I'm Dr. Theresa Garza, and I'm located in Plano, Texas. I am the Medical Director of Weight Management Medical Associates, where we specialize in seeing patients for weight loss and weight management. I am board certified in obesity medicine, and I'm also board certified in family medicine. I was born in Abilene, and at the time, there was really only one physician in the area. So we would drive probably 45 to 50 minutes. And when I say one physician, it's one physician that we trusted. And I think from that point, he really made an impact. And even though I looked at other things, investigated other things, I always was drawn back to medicine and helping people. I've been open since 2008, and I love having the ability to talk with patients about weight loss. Our focus is on the prescription weight loss medications, in addition to nutrition guidance, meal planning, and exercise and behavior modification. We also offer food allergy and food sensitivity testing. And a lot of patients think that reactions are more of environmental reactions, such as sneezing, itching, and whatnot, but actually more of the food sensitivities and allergies, they can actually manifest as headaches, vague joint pain, vague abdominal issues like diarrhea and constipation or bloating, also just low energy. So we do offer testing. It's blood testing and skin testing. The blood testing is more comprehensive, and we always check with insurance to see what's covered. Based on those results, we give patient what foods that they probably want to stay away from, but then at some point they can reintroduce it and see if how they respond to it. With eating disorders, true eating disorders such as anorexia and bulimia, we do not treat patients with that. I think that for the core of that, psychiatrists and therapists and psychologists are excellent resources. There is, now with the ICD-10 coding, which is the newer coding, there are new diagnosis codes, for example, for binge eating, even night disorder eating. So those patients will filter them, and we filter them by having that conversation. Normally our first visit is approximately 30 to 45 minutes. We look through their medical history, we talk with them about what their issues have been, especially around weight loss and their weight struggles. So with our patients, we do get to know them by their lifestyle, their baseline. Most of the patients that we see are very experienced with commercial weight loss programs like Weight Watchers, Jenny Craig, Nutrisystem, and various other ones. And I think those commercial programs are excellent. They build a great foundation. And when patients are looking into other methods or other options, to me, there is no competition per se. We just offer something different. And even though we help patients by using medications, we still go over with them their nutrition and their physical activity, also what's going on with their lives, because stress, poor sleep have a lot to do with weight loss as well. Any patient, when they first come in, they step on a body composition scale. It is probably the most advanced scale that the US has. For example, it checks your BMI or body mass index, which most people are very used to, but with this one, it actually divides muscle mass in your arms, your trunk, and your legs. It also measures the visceral fat, which is the fat around the organs, which is the unhealthy fat. And so we give them information that they probably don't know. And also, I think when people look at other people and think that they may not need to lose weight, people camouflage themselves very well. So especially with our body composition, you see the visceral fat, which it can be high. You see a high body fat percentage, even though their BMI may look fine. So we really try to look at the entire person. In my opinion, word of mouth is great, because then if you have a trusted source, you know that physician or that provider it can be great, but you have to do your own research. Go online, and I don't know if people know this, but anybody can actually look up a licensed physician in Texas, look up their name, and see if any suits have been brought against them, and check that way. You always want to check and see if your physician is board certified. There are a lot of physicians who aren't, and people just need to really be educated on who they're choosing. With Top10MD, I think it really supports the fact that people need to be more educated and that they need to perform their due diligence in researching their providers.